Hi, my name is Brandy Castle, and I'm an RN BSN student, and today I'm presenting on tuberculosis, or TB for short. Tuberculosis is an infectious disease that is caused by bacteria. It can be easily spread via contact with an infected person through the respiratory tract. An infected person can transmit the disease by coughing or sneezing, in return causing droplets to be spread throughout the air. TB is not transmitted by kissing, sharing food, or touching toilet seats. The causative organism found in this disease is called Mycobacterium tuberculosis. Tuberculosis has an increased incidence to occur in populations with lower incomes or those that have poor living conditions. The immigrants and homeless population living in the United States are the most susceptible persons to acquire the disease due to having poor nutritional habits, compromised immune systems, and unstable living environments. Most of the immigrants and foreign-born persons living in the United States are more likely to have been exposed to the disease in their country of origin and did not acquire the disease in the U.S. territory. Other risk factors that can increase the likeliness of acquiring TB include persons who are incarcerated, IV drug users, positive HIV status, poverty, and those that are very young, along with the elderly population. Healthcare professionals also tend to be exposed to the disease at an increasingly higher rate than other professions. In order for TB to be correctly identified, a series of diagnostic tests are administered. One of the first tests that is completed is a skin test called the Man-2 tuberculin test. A tuberculin syringe is used to inject a solution called tuberculin purified protein derivative just under the skin, which creates a small raised area. The test should be read within 48 to 72 hours after administration. If the area looks to be raised and reddened with an induration of 5 milliliters or higher, then a positive TB test is noted. If a positive skin test is found, follow-up testing is required in order to rule out a false positive reaction that may have occurred. A chest X-ray can be performed from a primary care provider to determine if the TB is present in the body. The physician may order blood work to be completed as well. In the latent phase of TB, a quantiferon TB gold test, which consists of blood work that can be completed to measure how the body reacts to the TB organism. Another diagnostic study being used to identify TB disease is known as the Expert MTB-RIF assay. This is a test that detects the causative organism Mycobacterium tuberculosis complex and resistance to rifampin in less than 2 hours. Sputum is collected and then mixed with the reagent, which placed in an automatic machine for processing. This advancement in technological studies may be helpful for those that do not have the TB disease due to decreasing the amount of money spent on unnecessary treatment for the disease. TB is nationally reported disease. Once TB has been confirmed by positive diagnostic studies, by law it should be reported to the state or local health department. Different states and jurisdictions vary at which level TB should be reported. Some states require that suspected or proven TB cases should be mandatorily reported within 24 to 48 hours. There are 2 different phases of the disease that have been studied. The beginning of the disease is known as latent TB. In this phase of the disease, there are no symptoms associated and it is not considered contagious. The immune system keeps the disease inactive in the lungs, and therefore it cannot be spread to other persons. In the latent phase, the TB test performed is read as positive, but other diagnostic studies used, such as a chest X-ray and sputum cultures, present as normal. Although if the immune system becomes weakened due to sickness or illness, the phase can become active TB. There are many signs and symptoms that are present with the active form of tuberculosis. This disease usually affects the lungs, but can also affect other body organs such as the spine, brain, and kidneys. The other body systems are exposed to the disease. The symptoms are usually specific to the area affected, such as back pain if the disease is spread to the spinal column. Other signs and symptoms of TB include a cough that may last longer than 3 weeks, chest pain, fatigue, a low-grade fever, unintentional weight loss, chills, night sweats, or a loss of appetite. More serious symptoms include respiratory failure, pulmonary tissue disease, and necrosis. Once a person has been exposed to TB and the disease has been contracted, it is highly contagious to other persons. When TB is converted to the active form, it takes between 2 and 4 weeks of treatment to become effective. After treatment for tuberculosis is given, there have been several variations of the disease have been found. Multi-drug resistant tuberculosis and extensively drug-resistant tuberculosis are two of the most common. Persons who have tuberculosis are less likely to acquire these several variations of the disease if they complete the anti-tubercular medications as prescribed. Treatment for TB is given to those that have been affected as well as those that have the active form of TB. A person who is infected is still given anti-tubercular medication treatment prophylactically for the disease. The active form of TB can be treated with isolation precautions, plenty of rest, and multi-drug therapy. When a person has become hospitalized once the disease has been diagnosed, a negative pressure room should be provided for the patient due to the highly contagious state of the disease. Patients that have a history of TB are also given a negative pressure room for precautionary measures. In several countries, including the United Kingdom, a vaccine known as Bacillus camelot-guerin, or BCG, is given to prevent TB from occurring. The vaccination is mostly given to children under the age of 16 who live in areas where TB is prevalent, or if they have family members that have a history of the TB disease. Immunizations are not given to those that have a weakened immune system, such as persons who have HIV. The vaccine is primarily not given to children in the United States due to the low occurrence of the TB disease. Primary, secondary, and tertiary prevention measures should be taken to reduce the risk of acquiring the TB infection or disease. For primary prevention, education and health promotion activities should be taught. One of the most important primary prevention strategies that can be used to reduce the spread of TB is covering up the mouth when coughing and shielding the nose when sneezing in order to decrease the amount of droplets that are released into the air. Even if there is not a positive diagnosis of the disease, these steps are important in decreasing the disease from occurring. Education and teaching should be focused on reducing the risk associated with TB. Proper nutrition, cessation of IV drugs, hand washing, and clean living conditions are a few of the positive health practices that should be taught to the public. Individuals who travel to other countries should be taught about signs and symptoms of the disease in order to recognize when they have become infected. Another prevention strategy is vaccinations. Although there is the BCG vaccine that has been found to be effective in preventing TB, it is only given to children in foreign countries that have a higher incidence in acquiring the disease. Secondary prevention measures should focus on helping persons that already have the latent phase of TB to prevent it from becoming active. Screening measures such as the tuberculosis skin test, the quantiferum tuberculin test, expert assay testing, chest x-rays, and sputum cultures. These methods can be administered to those who may present with symptoms related to TB. These screening measures should also be focused to the populations that have the highest exposure to TB, such as healthcare workers, prisoners, the poor, and the homeless. By educating the people about the importance of diagnostic tests completed, it would raise awareness of TB in our nation. Tertiary measures for TB should be focused on those persons who suffer from the active form of TB. Medications such as rifampin and isoniazid should be administered and directions should be strictly enforced. One of the most effective techniques for treating the active form of tuberculosis is by using directly observed therapy, or DOT. This method ensures a healthcare professional or trained personnel observes individuals take the prescribed medication therapy to ensure that the dose is injected and the regimen is followed correctly. This therapy has helped to significantly decrease the number of cases in the U.S. that convert the disease to the multi-drug resistant TB or the extensive drug resistant form. It is important to discuss with individuals the reasons that the DOT method is used and to learn why patients may not be adhering to the prescribed medication regimen. Nurses should provide supportive measures to the infected TB individual and their families. By providing support, encouraging treatment, and utilizing educational opportunities, nurses can become an integral part in assisting TB-infected persons. In conclusion, tuberculosis is a complex infection that can be quickly converted into active disease. Alerting a primary care physician when experiencing signs or symptoms of the disease aids in the treatment for the disease. Those populations that have a higher incidence of acquiring the disease should take precautionary measures to ensure that they do not become infected. Diagnostic studies and treatments continue to become more advanced and reliable when treating the disease process. By following prevention measures, individuals will become more knowledgeable of the disease and be able to participate in health promotion activities to keep TB from spreading across the nation.